we'll talk a little bit about alternations of musculoskeletal functions in children in following few slides. Congenital defects are relatively common, and one of the most common defects is syndactyly. It's webbing of the fingers, and on the other hand, it's fusion of the soft tissues on the fingers, and it's also may include fusion of the bones and nails. So that's the true syndactyly. And true syndactyly is more difficult to treat because fusion of the bones and nail occurred. But if it's so-called pseudo-syndactyly or just syndactyly, webbing can be surgically treated, and the chances of recovery are very high. Vestigial tabs is the presence of extra digits, and most of the time they will be surgically removed, not because they are functionally disabling, but because they may present in future some kind of cosmetic concern for the child. One of the important congenital disorders that we need to talk today about is the developmental dysplasia of the hip. And formerly it was called congenital dislocation of the hip, which is an abnormality of a femur, or to be more precise, of the proximal femur and acetabulum, or both. Risk factors include being female gender, metatarsus adductus, and first pregnancy and breech presentation. The hip can be present as subluxated, dislocatable, or already dislocated, but it's one of the most common congenital defects, and it's important to know how to recognize it. Patient will have, and by patient I mean the baby, newborn, will have asymmetry of gluteal or thigh folds. When there is a limb length discrepancy unexplained, it's always a concern. Limitation of hip abduction, and several tests, positive Ortolani sign, positive Barlow test, and positive Trendelenburg gait. Of course, baby may have, with the maneuvers, a pain in the joint, and may become irritable, and may present with cries. So the picture here presents the dysplasia of the hip with different manifestations, with and also how subluxation and dislocation can occur with the dysplasia. And with the dysplasia of the hip, you see that the socket actually is malformed, and that malformation allows for easy subluxation and dislocation. Deformities of the foot are quite common in pediatric population, and it's metatarsus abductus, forefoot adduction. It can be mild, moderate, or severe, and it depends on degree of deformity and flexibility. Equinovarus deformity or clubfoot can have several different presentation and its positional equinovarus, idiopathic congenital equinovarus, tetralogic equinovarus, and pes planus, which is flat foot. Treatment for this can include braces, sequential casts, and surgery to correct the defect. Rickets is one of the bone demineralization disorders, and what happens, insufficiency of vitamin D or insensitivity for vitamin D. Another cause will be renal wasting of vitamin D, or malabsorption of vitamin D will result of demineralization of the bones, or presence of the soft bones, and skeletal deformity. And it's correctable by administration of the vitamin D, and the easiest case to correct will be, of course, if it's an insufficient intake of vitamin D from diet, certainly to introduce it in diet, but other cases I mentioned may require more intense interventions. Scoliosis is another disorder that is quite common, and it's a rotational curvature of the spine. It can be non-structural and structural, and it can be a consequence of different skeletal abnormalities, neuromuscular disease, certainly trauma, and metabolic bone disorders, joint disease, and tumors. So by going through this relatively long list, of course we need to be more on guard for the symptoms of scoliosis, because this may represent certain significant conditions such as metabolic bone disorders and malignancies. Osteomyelitis in children, it can be a consequence of septic arthritis, and the reason is the presence of blood vessels in the infant's bones that may perforate the growth plate. Children can develop a blood abscess in the metaphysis of the bone, and in adults and adolescents this may involve vertebrae, and in adult and adolescents the patient may complain with back pain for several weeks, and of course the adults are much less often affected. In adults and adolescents, the osteomyelitis, the cause of course will be more external versus internal. Another important disorder we need to talk about today is juvenile rheumatoid arthritis. It's a childhood form of rheumatoid arthritis. So pathophysiology is the same. It's an autoimmune disorder, but the diagnostic criteria are different. So the difference is in a mode of onset, and arthritis can be in fewer than 5 joints, or arthritis can be in more than 5 joints. Again, it's a systemic disease, and another important consideration here, in adult rheumatoid arthritis may affect small joints more aggressively. In juvenile rheumatoid arthritis, we can see the rheumatoid arthritis affecting large joints. So this is the list of differences between juvenile and adult rheumatoid arthritis. Juvenile, again, has large joints affected. Subluxation, ankylosis of the cervical spine may be present. Joint pain will be there, but it won't be as severe. ANA, or anti-nuclear antibody test, will be positive, and ANA is a test that's non-specific for inflammation. So you may know that there is some type of inflammation in the body, but where it is, we are not certain. Chronic uveitis, and at the same time low level of rheumatoid factor, and limited subcutaneous rheumatoid nodules. Another danger here, that this may be common not only in the joints, but also it will affect other types of connective tissue and will affect heart, lungs, eyes, and other vital organs. But again, the etiology is the same, but however the manifestations and representation of the symptoms is different. Cerebral palsy is a disorder of static tone and balance, and an ischemic insult to the brain is to blame. Patient will present with hemiplegia, diplegia, quadriplegia, and it's a perinatal disorder. There have been so much said about cerebral palsy in the past, and significant body of literature present. The problem with it is the ischemic insult to the brain, again, happen at some point at perinatal period. Some would blame that the incidence of cerebral palsy is, or increase in incidences of cerebral palsy is related to increase in number of cesarean section births in recent years in order to avoid liability related to cerebral palsy by obstetricians. And one of the theories of occurring of cerebral palsy, that hypoxia may set in if the delivery is complicated or delayed, even though some would say that patient or the baby will not be presenting with significant periods of deceleration, but however patient will be still affected somehow by the long duration of the delivery. Muscular dystrophies is certainly a big group of disorders that can cause degeneration of the muscle fibers, and in this case what happened, it's degeneration of muscle fibers that will cause weakness of and wasting of muscles. And also one of the bigger problems with it, it can affect the respiratory muscle and ultimately resulting in respiratory arrest or the need for artificial or mechanical ventilation. Duchenne muscular dystrophy is the most common muscular dystrophy, and it's X-linked recessive disorder. It's a disorder of X-linked recessive inheritance. What happens, there is a deletion of segment of DNA or even a single gene that sits on a short arm of the X chromosome. So this may be called like Duchenne muscular dystrophy gene, and that gene is encoding for the dystrophin protein. Dystrophin, that protein, it will mediate the anchorage of the actin cytoskeleton of the skeletal muscle fibers to the basement membrane, and the result will be muscle wasting and muscular dystrophy. by the age of 3 years old, the child will develop the manifestations of the Duchenne muscular dystrophy, and that it will be shown as decrease in motor development. Patient will have progressive weakness, and again muscle wasting will set in. And if it's earlier than 3 years old, the child will not be meeting the developmental milestones such as sitting and standing, which will be delayed, and the child will be appearing clumsy with frequent falls, and one of the signs that child will have difficulty climbing stairs, because it requires significant physical energy to do so.